And we are recording. And if nobody has any sound issues, then we'll go ahead and get started. Peggy, I'll turn it over to you.
Okay, thanks so much, Tim. So good afternoon. Glad that you're here today for another information session. We're going to go through a few updates, and then, like Tim said, we'll be talking about reporting requirements. But I'll tell you up front, you don't have to take really good notes because you'll have the report form and instructions. This is just to give you a heads up on what kind of data we're going to be collecting. So first, just a couple of updates. The grant identification IDs that are in your invite letter works a little differently than what the instructions say. So when you go into your invite letter, you'll see a button that says grant identification ID. You actually click on that button. It's going to take you to what we're calling a landing page, and you'll see your identification number filled in the field. And then there's an update or a submit button. Click on that submit button, then it takes you into the application. So it just works a little differently than what the instructions say. Any questions about that? So we did ask that the character limits be set on all the narrative questions. So those are set at 2,500 characters. And so it should tell you when you're getting close to that, or if you're cut and pasting from a Word document, then you can do your character count on your Word document and then pull it over so you'll know how many characters that you have. Okay. So on to reporting. So we'll report data quarterly, and for the time period of November 1st through September 30th. Since we are starting the grant late, your first quarterly report is going to be for 2 months, for November and December, and that'll be due January 31st. Your second quarter, which is January, February, March, will be due April 28th. Your third quarter will be due July 28th, and then your fourth quarter will be due October 31st. And most of that data is going to be data. There's just a few narrative questions, but mostly it's going to be your output data. And then you'll have annual report questions, which will also be due October 31st. So what's going to be on those quarterly reports? I have slides that aren't advancing. So you're going to be asked about your direct client services. And there's some demographic information that'll ask you: the age of the client served and the race, ethnicity. These are going to be unduplicated counts. So you would use the age of the client when you first saw them. And again, all this is going to be in the instructions. We're just wanting to give you a heads up of what we're going to be looking for. And then other demographics would be the number of folks you serve through language services, interpretation, or by bilingual staff. And we expect those are going to be 3 different questions. So you'll answer how many you serve through a language, like a language line, how many you provided interpretation for, and then how many were served directly. And then number of clients that self-identify as lesbian, gay, bisexual, transgender, or queer. And we are not, this is voluntary information, so we're not telling you to force anyone to answer. If they decline to answer, that's okay, because all of these are going to have an unknown attached to them. So if you don't get this information, it's perfectly okay. So what we're going to be looking for and reporting for services to victims is the number of clients, and you'll report youth and adults separately. So for your youth clients will be age 13 to 17. Your adults will be anything above the 17. So we're going to ask for the number of clients who received each of these following services that we're going to talk about. This happens to be youth. So all of these will be the questions that will be asked of you for your youth clients. You would count each client only once for each type of service that they receive. So it's an unduplicated count. Does that make sense? Because you're going to be reporting quarterly, you'll report new clients for any of these services. Sense? So the report will ask you for new and returning clients. So that you report each one of these only once. So if a youth received financial assistance 3 times, you would only count once here. Make sense? So it's an unduplicated count.
Peggy, do you mind if I ask what kind of financial assistance?
So it would be, if you look at like emergent needs on those focus areas, it would be making third-party payments for clients for rent or relocation expenses, or all of those things on that, on your focus areas that are allowable under this grant. Make sense? So we're going to be asking for financial assistance, third-party payments. We're going to be asking for folks who receive virtual or mobile crisis intervention. I'm going to be asking for folks who receive individual or group counseling or teletherapy. And it's going to be 2 parts to this question: if they are served by someone other than a licensed professional, or if they are served by a licensed professional counselor. So break those down into 2 questions. So again, it's an unduplicated count of all victims that you would serve for these different types of services. And then when we move on to adults, we're asking a little bit, some of the same questions, but we also have some additional questions for adults. And again, count each client only once for each type of service that they receive. So again, we'll ask for adults receiving financial assistance. Now, just something to be aware of: if you don't provide that service because it doesn't fit within your focus area, then you'll just put 0 here. Does that make sense? And then number of adults, again, receiving virtual or mobile crisis intervention. Number of adults receiving victim advocacy services. And number serving individual and group counseling, again, by anyone other than a licensed professional, so peer counselor, and then separately by a licensed professional. And then number of victims receiving virtual or mobile criminal, civil, or legal advocacy. And then number of victims receiving medical accompaniment, receiving transportation services, and then adults who provided on-site COVID-19 testing or vaccines. Again, if you're not doing on-site testing, you would just put 0 on those if you're not providing that service.
I'm sorry, I don't understand virtual medical accompaniment. How can you do virtual medical accompaniment? Is that not hands-on?
Some folks are doing it virtually. So they are setting up laptops or tablets in the hospital where the advocate speaks to them over.
Okay, so that's not the nurses, that's the advocates.
Correct.
Okay, I'm
Yes.
confused that with the nurses doing
No.
forensics. It's not forensics, it's the.
No, it's not. It's the
Okay.
advocacy piece of it.
All right,
Yeah.
thank you.
Mhm. So, wait, I want to go back one and just say something before we move on to education. All of these services that we've been talking about, when I told you that you report the number of victims, an unduplicated count of number of victims who were provided this service, you'll also need to report the number of instances of each service. So dual things, right? So you will report unique victims who, like, let's say, receive transportation services, but you're also going to report all the transportation services that any victim received. Does that make sense?
Yeah, and I think some of the, Peggy, just sharing, I think some of the reasoning behind that is the federal reporting requirements are the unduplicated count, but we really feel like a total number of the count of services is a much better way to talk about impact and the story of the work that y'all are doing, right? Like you might have one person receive transportation services over the course of a year 10 times, and if that just looks like one, multiply by however many, survivors you're working with, then it doesn't really tell the full scope of the work that y'all are doing. So we don't love the both. We would have loved to have just done it by service, but there's also the federal reporting requirements that we're having to meet.
I have a question, if you don't mind, for the transportation. Sometimes we have victims who can't get, like, I had a lady who, she was sexually assaulted and pregnant, and she didn't have a way to get to the hospital. Can we pay for, with this grant, can we pay for transportation, like a Uber or a cab or a service of that nature to get her to the hospital, to get her forensics exam, the rape kit completed?
So look at your focus areas, because there are a couple of focus areas that will pay for victims to travel, right?
Okay.
So look at your focus areas, because it'll tell you if you're
Okay,
able to pay for transportation. And then you can buy bus passes. If you can't give a victim money directly, so you may have to pay a third
no,
party,
right.
right?
We understand we can't give money directly, but like you said, bus passes or
Right.
something, or make arrangements with a taxi company, make arrangements ahead of time. So that way, when we need them, because it was like 3 o'clock in the morning when she called.
Right.
Okay, thank you.
Yeah. So again, you'll be unique number of victims and the number of instances, because what we know, I mean, counseling is a really good example. Folks usually don't come in for one counseling appointment. So to really show the depth of what these funds are going to, we really felt like we needed to get instances as well. That because we have some tools that can help you do that. So I'll talk about those in a minute. And then we'll be asking you to report on any education that was conducted by your staff on this grant, or education that you use this grant to create that content and materials. So you'll report on that. And you'll be reporting on, like, the number of presentations, number of participants for both adults and for youth. And you'll report those separately. Also going to ask you how many full-time positions that you paid for with this grant and how many part-time positions. And then these are the narrative questions that will be on your quarterly report. So we'll ask you about turnover, if you've had any turnover of grant funded staff or in key positions. It'll ask you to give you a summary, like to give us a summary of your activities related to your chosen focus area. So it'll just be like a summary of what you did that quarter. It'll ask you to talk about progress on spending down the funds. Like if you feel like you're having a challenge with spending all the funding, and your progress on reaching the objectives as well. So there's just going to be very few narrative questions on your quarterly report. At the end of your fourth quarter report will be an annual report. And that's going to be a set of narrative questions that are directly related to your activities. So, and also how you reached underserved populations. There's some questions about that. The impact of your funding. It's going to ask you to talk about one particular client that stuck out that really was helped through this funding, or what were you able to do with this funding that you probably had not been able to do before. So there's a set of narrative questions that you'll answer one time at the end of your fourth quarter report, and it will just flow with your fourth quarter report. So you'll just see it, at the end. Any questions so far? So we're going to help provide tools to assist you with data collection. The first one is we're working on a method and tool so that you'll be able to track your unique clients per service. And then we're working on another tool that will help you track your instances per service as well. So we'll get those out to you. Those tools you don't have to use. It's just a resource for you if you want to. If you're doing any third-party payments, you will be required to use a client tracking log. We'll give that to you as well, where you'll just track all your third-party payments on behalf of survivors, like when you're talking about transportation, or if you're paying someone's rent or relocation expenses. If you're doing that focus area, particularly where you're doing emergent needs for survivors, then you can record all of those third-party payments on this tracking log, and we'll provide that for you. And then questions. I'm going to stop sharing for a minute. And we did have some additional questions, and I want to go through some of those first. We had some additional questions from the last session that we have not gotten out yet. I just want to go through those so we all know about those, and then we'll leave time for some questions at the end. So someone asked if they could choose to rent vehicles instead of requiring staff to use their own. And answer is absolutely, you can choose to rent vehicles instead of requiring your staff if the rented vehicles are used only for the purposes of this grant. Okay. So if your advocates are going out into the community and you don't want them to use their own vehicles, perfectly okay to rent vehicles. And the next question, can an organization pay for vehicle maintenance expenses for staff members who use their own personal vehicles? And that we are not able to do. So if staff uses their own personal vehicles, the only thing that can be charged for that is mileage, because IRS assumes that the mileage includes maintenance and gas. So any separate vehicle maintenance would be considered a personal gain, which is not allowable. If you end up, under the mobile advocacy, if you end up purchasing a vehicle, then you can do maintenance on a purchased vehicle. Someone asked, are longevity bonuses or bonuses based on time spent with the agency appropriate for this grant? So remember, we said that you could give bonuses across the agency. So yes, longevity bonuses would be allowable as long as you have a calculating the bonuses. and that method is applied to everyone. So for example, if you gave X amount of dollars for anyone who was at your agency for 0 to 5 years, and you distributed those equally amongst all those folks who were there during that time, yes, absolutely. Or if you gave X amount of dollars for someone who was at your agency for 5 to 10 years, as long as you can show that you're distributing those funds in an equitable manner. Okay. And then someone asked, what would be considered a fair amount for bonuses? And for that, your organization will determine the amount of the bonuses. There's a couple of things that would drive that. So just a reminder that the bonuses, those type of expenses, are in support of your main focus area. So you would want to make sure that you had sufficient resources to implement your chosen focus area. But other than, being able to do that, you would really make the decision on how much bonuses that your agency will provide. And those are all of the additional questions we had. We're posting them on one of the TAS's sites. So in your invite email, when you have all those links to like the grant announcement, the instructions, the grant questions, and the Q&A, when you click on that link, it will go to the new Q&A with these new questions added. Not quite up there yet, but it should be sometime today.
Peggy, I have a question.
Of course.
Are only expenditures after or on or after November 1st eligible?
It's only expenditures after the contract is executed. So we're, yes, we think that's going to be November 1st. So if folks are signing their contract and getting it back to us and we sign it, that's when it becomes a live contract. Does that make sense? So
I missed
November
one part of
1st.
that. I apologize. Could you repeat yourself?
Yes. So we expect all, okay, let me start again. It's after your contract is executed. So as long as all those are executed by November 1st, which we expect that they will be, that's when the grant starts. But you wouldn't be able to reach back to like October 1st. It
Okay.
would start, yeah, it's going to start November 1.
Okay, thank you.
Mhm. Questions?
Will there be output targets associated with any of the measures that you described, depending on your chosen focus area?
So we are not doing output targets this year just because this grant is so new. We don't know what it's going to look like. So we wanted to give that first year kind of to see everybody's going to have to start gearing up to, to provide those services. So there won't be any targets this year.
And if we're doing mobile advocacy, I'm guessing that we can count any allowable services performed by the grant funded staff members. Our thought is that we want them always to be doing direct services, but the kind of outreach and partnership development that they're doing may not immediately result in those community-based services that we eventually want to reach. So the thought is that we're going to assign them adult sexual assault clients that are part of our typical client population at first, so that they're like getting the experience doing the direct services if they're not people who are already on our team and coming from that role, while they do the outreach and build relationships. And then we try to transition their caseloads more over to the populations that we're targeting for mobile advocacy. Would that be an okay way to like still be able to have the direct services immediately when the grant starts, but then work towards the objectives?
So Tim, do you want to weigh in on that? I mean, I think that's a beautiful way to do it. I think as long as they have time to do that outreach and build partnerships, so it doesn't preclude them from going out and doing that, I think it's a great way to do it. Tim, would you agree?
Yeah, I agree. And I think the other thing too, like, to make sure that you, again, we'll be getting you the guidance out so you can also see what those annual questions are, but I can't remember for sure off the top of my head, but I'm 99% sure that there's something about like work towards partnerships, or at least like a
Sure is.
number of new partnerships. So I would also, like, while they're doing that, I would keep track of that work too in some way, in some way. It doesn't need to be super detailed, but it's not only those services, but when you get to the narrative questions, there's definitely a question about like those partnerships that you're forging with other community orgs or social service orgs in other communities as part of the mobile advocacy. So yeah, no, I think that's a great, and yes, I would count those numbers
Yes.
even before they make that transition.
I have what I think is kind of a similar question. Our project design is really focused on the infrastructure and supports that we have been lacking over the last couple of years to improve virtual services and to address COVID. And it is less focused on paying staff salaries. So as far as performance, we see our investments touching, all of the adult sexual violence survivors that we're working with at the agency. That's going to be appropriate, right, for those output targets.
So when you start talking about the output targets, it is only for grant funded staff, right? So counseling, those kind of target or those kind of services, you would only count grant funded staff who provided those services.
I think we talked
So-
before about we're not intending to have any direct service staff on the project.
Right, and that's okay. You don't have to, but there's going to be a lot of opportunity for you to talk about
Okay.
like the infrastructure that you're building, especially when it's asking you like, what are your activities for your focus area? And especially when you get to those narrative questions, there's going to be that are yearly, there's going to be a lot of opportunity to talk about like what you did with this funds and the impact it made. So don't worry that you won't have like the numerical data.
I promise I'll try not to worry about not having numerical data.
And so
I
like
understand that, yeah.
for transparency's sake, like the quarterly reporting is coming to us.
Okay.
We'll roll those numbers up when we have to turn the report over as part of the annual report to HHSC, but they're not necessarily going to be down into that level of detail. And so
Okay.
we know that context, and even if they were to ever get a hold of that, like we have so far a pretty good relationship with them, and they really are kind of relying on us because they haven't done sexual violence work before. So I feel like if they ever ask that question that we can explain, we can also explain that away to them as well. But they will not really be in that quarterly data other than as we roll up those numbers for an annual report.
Okay, very good.
So
Thank you.
as we release the report, what we're going to try to do is like let folks know which questions go to which focus area, because there are some focus areas that you won't answer questions for and the others you will. So we'll try to pinpoint that so that you'll know, hey, this doesn't go with my focus area, so I don't have to answer this question. Does that make sense? But yeah, you're not going to have numerical service data if that's not where you're spending funding. And if you need us to remind you, we will. Does that make sense? Don't get worried about it.
Jasmine, the only thing I would maybe add is that, like, even though we won't need you to report those numbers, if when we get to the end, you can include some of that in the, like, as a result of this, we went from over the course of a year, this many people getting virtual to this many that you're probably collecting anyway. And weave that into the narrative. I think that's another way to kind of get at that.
Yeah. And it will ask you for like impact. You can definitely like put it in.
We have
So-
Borderland with their hand up.
Okay.
So I think you kind of answered this, but like if we're using money for like, let's say retention bonuses, right? Like staff retention bonuses, that doesn't then automatically make them grant funded personnel. That's a different kind of category, right?
That's correct. Yes. they
Okay,
are
good.
not
I just
grant
wanted to,
funded. Yeah.
right. I just wanted to clarify.
Yeah.
So if it would only be for any grant funded people through this money specifically, not any other grant that we have.
Correct, that you would report on. So if you put any personnel on your budget, then yes, you would report for their services. Yeah. Questions?
I have a question, Ms. Peggy. Is anyone, and that's for everyone who's participating today. Are you having trouble transitioning from your current way of doing things to this new grant with the current services? Anybody else having trouble trying to transition from the way this grant is compared to what you're normally used to doing with your current services? Making the transition from the current way you're doing services to this new kind of virtual grant services? Is there a transition period for you is what I'm asking? Anybody? No?
Cheryl, are you saying you haven't done virtual services yet?
Yeah,
but
we've done virtual, we're doing it right now.
Okay,
But what I'm asking is, some of the people the partners that we have, they don't have the equipment to do the virtual services. So we make appointments by telephone. Some of the clients have their own phones and they do the virtual on their cell phones. But
mhm,
the agency itself doesn't have the capability, or they don't have the laptops to do virtual. We offer to loan them some of the laptops we have, but they're resistant and we can't force them to,
okay.
but they're resistant to do it. So what we do is we make telephone appointments, teleservices for their
Mhm.
clients.
Yeah.
So, and with the focus that we have would be the mobile advocacy. So we do the outreach. We just go over there and
Mhm.
provide the services if they'll allow us to. But in some of the other cases, then what we do is make telephone appointments. So we're still able to reach the clients. And that's what I mean when I say having problems with some of the transition. It just depends on who the partners are and what they allow us to do at their agency.
So it
And that's
sounds like most of the either virtual or tele or mobile stuff that you're doing is to clients that are like at other, either connected to or actually at other community organizations or social service organizations. Gotcha.
Right. We're
So
limited to what they allow us to do is what I'm saying.
Right, yeah.
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 So then the transition part that you're struggling with is that the community partners aren't necessarily super excited. It's interesting, they don't even want to take loaner laptops. Because I was going to say that's part of what you can absolutely do here. Like you can't buy it for the organization, but you could buy that kind of equipment and let them use it. You can even, loan it out to survivors directly if they want to access things that way. But that's interesting that they're struggling with that.
Yeah.
Was someone going to comment back to Cheryl? I thought I saw somebody.
So we don't have exactly the same situation, and this is not so grant related for us because it won't be part of our focus area for the grant. But I did just want to commiserate and say you're definitely not the only one who's had problems figuring out how to do virtual services, especially in collaboration with other community partners. I know the one context where we really were not able to make virtual services work well was in any type of accompaniment, be it police, forensic exams at partner agencies or the hospitals. We tried to do it for a brief period of time when the health protocols were just not allowing us for a while to go in, and we tried to do it virtually to still offer an option. But we did have trouble just working with the IT departments at the various places. Sometimes even the places like the hospitals that have a lot of resources and have all the IT services and capacity, then they didn't want us to be in their security system. So we still like have trouble using our laptops to fill out forms on our computers at the hospitals because they want us on their guest network. They don't want us on their good internet there because then we'd have access to things. So there was a lot of, I think when we were trying to work those things out, like administrative back and forth on how our systems work with their systems. And even if and we did the same thing, like we purchased tablets and gave them to some of the spaces where we did accompaniment, and it was hard to know how exactly it was being offered. So it was either the clients just weren't really wanting to be on screen, which is completely understandable as well in that setting. And would rather do a phone call or rather just take our information and call us or not call us later. Or it was, potentially the people who were providing the services on the other end were maybe like not presenting it in as appealing a way, or were a little bit more reluctant to offer it just because it interfered with their usual ways of doing things. So it can be a hurdle for sure. And I think I can't give you a good solution because we ended up backing out of doing the tele-advocacy, at least in our own local service area where we can now send people back in directly. But we've just found that certain things work well over Zoom and through the telehealth methods, and certain things don't. Like a lot of our counseling clients still really want to do telehealth, even though they have in-person options. So sometimes we have our counselors like sitting in the office doing Zoom appointments with people because the people would rather do Zoom. It's hard for them to travel. It's easier for their schedule if they can just go in a private space and open up their computer rather than having to physically get somewhere. So like for counseling for us, it's worked well. For advocacy for us, not so well. We've had trouble with the accompaniment. We've had trouble even doing like case management sessions over Zoom. Like when it's offered, people would rather call, or oftentimes people would rather just be able to text their advocates whenever they want. So I would say we do more of that than we do like actual telehealth visits for anything advocacy related. And it may be different for other people. That's just kind of how it landed for us. So I'm curious too, because we're going to try to do mobile advocacy, whether those partnerships that we develop, folks will really just want us to be on site and present, and like sending our grant funded staff members to sit in their offices to meet with whoever is in need of services, or whether we'll have some telehealth component. But I expect that it will be probably more in person than not.
For that feedback, that's great. And certainly can use these funds to help build partnerships. But I know, at the end of the day, there's only so much you can do, if your partners aren't willing, definitely. Anything else? Y'all have any issues with the application? I don't know how many of you have gone in to try to be in the application yet. Just don't hesitate to reach out. I did want to talk about those grant IDs because it's not really intuitive when you look at it, because I kept looking at it thinking, okay, where is the application button? And it's just not there. So yeah, when you click on that grant ID, it takes you to another page, and then submit that will take you to the application. And once you get in the application, on your right hand side at the top of each page is a place where you can save it and come back later. So when you save it, it will pop up and ask you to put in your email address and a password. And when you put in your email address, it will email you a link that you can always use that link to get back to the application. So definitely let us know if you have any trouble with the application. It should follow those application questions that you have a link to in your welcome email, and the instructions also. The questions go right down the application questions, so you should be able to see that before you even start by clicking on the link to the application questions in your invite email, so you'll know what to expect when you go into the application. Back on it, you know, how you find it, what your user experience is like. We really do want to hear that. Make this recording available in case you want to watch it again. And anything else? We're
Ask
way ahead of time.
a different question, like how are you feeling about this? Like, is there some excitement around it? Is there still like trying to figure it out? Kind of curious as to where folks are at with all of this. Love to hear kind of that side of it as well.
We're excited. This is a big opportunity for us, and we really appreciate all the work that you all have put into it. And a lot of the pieces, I think, came together for me today. So thank you.
Okay.
Yeah.
They're still trying to.
Yeah, I see in the text chat, there are a lot of options, still trying to figure out which road to head down. That was, I think, both the exciting and the overwhelming part of this kind of grant. Is like, we wanted to be able to pass on all that flexibility. And even as we were doing it, we're like, well, this is a lot of flexibility for folks to figure out which direction to kind of head in. So
Truly recommend people to read those summaries on the 4 focus areas to give you an idea of like what main kind of theme you want to work on, because then all your flexibility kind of just kind of flows under that main theme that you feel like is most important to your agency and to your community.
So maybe,
I have a question if you all
Yeah.
about someone mentioned earlier about renting cars. What is the process about doing that? Do we get a contract with the car rental like Enterprise or whatever dealership and in advance so that we can put it in the budget? I guess that would be a rental fee for a year, 1 car, 2 cars, or whatever. I've never done that before. That's why I'm asking.
Mhm. I think it would depend on what you feel like your need is going to be. So do you feel like if you go rent a car when you need it, then that's pretty straightforward. You go, but are you talking about renting a car on an ongoing basis?
I don't know how to, we'd have to put it in the budget. We're writing the grant right now. So obviously we have to put it in the budget ahead of time. So how do we estimate how much to put in the budget? I guess we call the rent-a-car facility and get an estimate of how much it would cost per day. And then we would estimate how many days we think we would need it per year. That way, I guess that's how you do it.
Yes, I think it'd be similar to how you estimate mileage. So think about how many people, how many trips, and then
Okay.
definitely you can get a quote from a rental car company, although you might want to ask them what is their average, because
Okay.
it's going to fluctuate by availability and
Type of vehicle.
type of vehicle that you want and need and things like that. So you might ask them for an average. And if you're thinking about going that route, ask them for their availability, because during the pandemic, rental cars have been
Right. Pretty scarce.
depending
Yeah.
on where you're trying to
And-
rent them from.
and I would pick one and ask them if they will give you an account Because like I know at TASA and we were, you know, well, I know every organization is kind of different size, but we've got around like 40 staff. And it's not on an ongoing basis, but it's when we're traveling further out. But we have an account and that gives us a little bit of a discount. So you might look into that as well. But yeah, I think just kind of estimating and remember, like, I know some of you probably have like OAG grants, and maybe not all of you, but some of you probably have grants where like you can only do like one adjustment, or it's not easy to do adjustments. That won't be the case here. And especially in the first year, we're anticipating that folks, you know, you can do budget adjustments as you need to. Hopefully that won't be like weekly. But you know, as you realize things come up, you know, there's absolutely that kind of flexibility to make adjustments. And I'll say that we would anticipate that particularly this first year, even more so, as you kind of get a sense for, you know, here's what we want to do, but here's what it actually ends up looking like. There's flexibility within that as well.
I think I'm gonna try to shy away from that.
I'm
I'm just asking.
Yeah.
And once you go in and look at the application, the budget is a little bit different, and especially for travel. You can estimate all of your travel into one entry. Does that make sense? So you don't have to break it down per staff. You can just, it'll ask you for, I think it gives you a few lines if you want to add them under travel, but you don't have to. You can group it all together. It'll ask you for a description like rental car, hotels, all of that. And then your justification and then your cost. So you don't have to break it down by rental car, this amount. So it kind of gives you a little bit more flexibility to do the best you can in getting a quote, but you also have some room to be flexible. That makes sense. So if you find out, okay, you know, staff who said they want to use their car now don't want to, that's okay, because you have it kind of in one big category. Makes sense.
Yeah, and Peggy, I think that's a good kind of something we've been talking about, like as you're building your budgets, there's lots of space for lots of line items, but don't feel that means you have to really like separate every individual cost out. If there's a, you know, a title that fits a few things that are like similar kinds of costs. A great example that we've been talking about is office supplies. Like, you know, you don't need to go in and do, you know, paper, printer, cartridge,
Yeah,
pens, like notebook, you know, like you don't, that's all one line item. And where that will be helpful for you is that when you do, just because of the system we have, which I think all of you are familiar with, doing through Salesforce, which we are making improvements to it, but some things will still be the same, which means when you do a reimbursement request, it'll be by line item. So the more line items you put in there, the more you have to then break down every reimbursement request. So if it makes sense to combine things together, then by all means do that.
and we particularly did not like label categories because we wanted you to use the categories that make more sense for you and your agency. So yeah, you want to group them together. That's great. I think supplies gives you 15 line items. You do not have to use all 15 line items.
We are not asking you to put them in 15.
No, we're not. Break them down the way it makes sense to you. And to where you can reasonably know that you have an estimate of what you actually think you might spend. And if it needs to change, like Tim said, you can do a budget adjustment. This is not like, we want it to be workable for you. And Cheryl, to answer one question you had, there is a spot on your budget for third-party payments. It's separate. So you'll see that and kind of all that that entails. And you can group all those together too. I think there's 2 spaces for you to have 2 line items. You do not have to have 2 line items. If you feel comfortable in grouping all of them together, you can do that. I think personnel and fringe is the only, no, personnel is really the only one that, you do a line item for each person that's on the budget. But other than that, in professional and consultant, you do one for each kind of group that you might work with. But other than that, you can group those things as you see fit. Else.
Any other questions? All right.
Certainly call us if you have any questions. We get in the application and have questions. Just want to brainstorm over what focus area that best fits your needs. That's what we're here for.
All right. Well, just a reminder that the deadline for the application is October 11th. And then we'll be doing our work on the back end to get you contracts out based on that. Do any follow-up that we need to, so that y'all are ready to hit the ground running by the 1st of
And Shannon,
November.
we're going to be doing the contracts in DocuSign, right?
Yes.
So you'll be able to sign your contract in DocuSign and then back to us. So that should make the process go quick.
I did hear right, there's no target levels.
There are no targets.
Okay, I put a target level in my narrative. I guess I can take it out of there.
You can, I mean, you can leave it in the narrative if you want to, but it's not going to be targets that we're
Okay.
going to look at your output at the same time. Like this year, we just don't know how this is going to work. So I just didn't feel like targets would be helpful.
This is an outstanding grant. I wish we had this years ago. This is really great. Thank you all.
Well, we love the flexibility of it. We want to really talk about that in the reports on things that we got to do with this grant that didn't normally get to happen, and how that impacted the infrastructure to hold up all of services. We're hopeful that we can show some of that coming out of this grant so that other funders will say, wow, like this stuff really works, right?
Yeah. Yeah, and we will be using, I mean, that's why when you see the narrative questions, like our goal is to be able to use this to advocate to funders, like, here's how you need to open up, be more flexible, and here's why, because when you do, this is what can happen.
Yeah.
So that is absolutely our goal with this grant. And to try to get them to give it to us again. That too. All right, well, thank you for your time. Like Peggy said, let us know if you have any other questions, and we'll be talking to you all soon.
Have a good one.
Thank y'all, and thank you again to our interpreters, to Susanna and Susanna, for help making this a bilingual space. So thank you so much for that work.
Yeah, thank you.
All right. Bye, everybody.
Bye.
Thank you, Susana. Not Susana.
Yeah, thank you so
Yes,
much.
thank you so much.
You too. Bye, everybody.